So I'm Neil Stafford, I'm the Principal Information Analyst with responsibility for unscheduled care within the Information Management team. Information Management, we do a lot of routine reporting and ad hoc reporting covering various different subject areas from ED tendencies, waiting lists, inpatient day case submission. We also support the North and South partnerships and provide a whole host of ad hoc information requests to clinicians and managers. And we also supply national returns to the government and Public Health Scotland. As part of Operation Flow, the executive team visited Tayside to look at how the Tayside board managed their flow of patients, specifically with unscheduled care. Central to the Tayside approach was a command and control centre, and part of that was the Athena application. So Athena is a cloud-based program or application that combines data from different sources, so ED departments, bed occupancy and current inpatients, and puts it onto combines it into one place that staff can look at it. We have all sorts of data sources and dashboards that we produce. So we've got an ED dashboard, we've got a bed state dashboard, and we do have inpatient information that all sits separately and doesn't talk. What Athena does is it combines it into, not quite one place because there's different pages and different screens, but it combines it into one application that staff can then use to give not the full picture but more of a whole system view of the flow of patients through the sites. The main idea of it is it's going to be in a command centre, so Monklands has a room that's designated as a command centre, and as part of this we've deployed three 45-inch touchscreens into it. So the idea being there'd be a screen each for each page, so there'd be a bed page, there'd be an ED page, and there'd be an inpatient page. The data refreshes live, so it literally is whatever's in track care at this moment in time gets brought out, and we refresh that every 5 minutes, so there's always a current view, there's no lag, there's no delay. It gives you live information to try and see what's happening, if there's any issues, or how you can try and manage that.
My name is Amal Rafiq. I'm one of the senior analysts within Information Management, and one of the projects that I've been involved with is the new dashboard that we're developing for blood glucose. So basically one of the senior clinicians within NHS Lanarkshire approached us. He was interested in getting a blood glucose dashboard set up. So after talking to him, we approached NHS Lothian, approached our colleagues there, and they'd just recently completed a dashboard. So we spoke to them about how they set it up, how the ETL process extracts from load for the data, how that's set up, refresh dates and so on, refresh times for the dashboard, how that was all set up. I spoke to them, and then we went on. We've got a point of care system here called Aegis, where all of the blood glucose data is collected. So having a look at that, we kind of went through it all, had a look at all the data that's collected on there and what we need for our dashboard, and then created the ETL and the data map just in the background for the dashboard. Basically, it will give you all blood glucose readings that are done within NHS Lanarkshire for inpatients. It will also highlight hypo and hyper episodes where patients' blood sugars are either too low or too high. So then you can try and see what sort of times that happens at and when events happen, and try and tackle and improve patient care. Yeah, so the senior clinician that approached us for the dashboard, he was interested in patients that have hypos with the blood glucose goes too low, and a lot of that can happen at night time where the patient hasn't had a snack, and then that can have an knock-on effect for length of stay as well for inpatients. So yeah, hopefully if that's managed better, then the length of stay, we're interested in getting that lower, and that's what the clinician was interested in.
So I'm Owen Gray. I'm an information assistant working in information services, particularly in waiting list and times team at the moment. So I started in the exact same team that I'm in just now. I started at the very start of September as a modern apprentice in information services. The qualification that I'm doing for modern apprentice is data analysis. So it was sort of the obvious thing that I wanted to go into, and in October a sort of opportunity arose for a full-time position within the same team that I was already in, which was one of the main reasons that I wanted to stay within that. We do a lot of different weekly, monthly and quarterly reports, as well as different ad hoc reports and FYI requests. So when I first started as an information assistant, I was mainly doing all the weekly reports. So we were doing a lot of weekly reporting to the Scottish Government, a lot of different other sort of monitoring reports that would go to the different services, monitoring different waiting lists and times and things like that, and trying to reduce that. But so yeah, a lot of the reports would highlight different categories of the waiting times. So we would do that. I would do that on a weekly basis. So there was various different ones, and then I started picking up different ad hoc requests as well as I sort of learned the services and the services that we provide a lot more. I was able to start picking up different ad hoc requests, which come into us on a daily basis. I'm very confident in a lot of the reports that I've been doing for a while, and I've learned a lot about the different services that we provide in quite a short space of time. I've learned a lot in it, but I know that there's still a lot to learn within that, because I think it takes years to sort of get that sort of knowledge and experience about the different services and everything that goes on within the NHS. That's probably one of the other things that I've really enjoyed learning, not so much about the different services, but also where that data comes from, how it almost starts, first being recorded on things like TrackCare, and then how it ends up on our system and how it is then published. Quite enjoy learning about the pathway of how the data starts and how it ends up being reported nationally by us.